We're also seeing something that we now call the Postcovid Syndrome. After they've had their 14 days of infection and recovers from COVID, whether you recover less than 14 days or after 14 days, these are people who develop prolonged COVID symptoms after full recovery of the disease. And these symptoms can be COVID-related symptoms, and they continue to have those prolonged symptoms. And this can go on up to 12 weeks after complete recovery of the COVID infection. We also have a scenario where someone who has had COVID infection recovers from COVID, and after the COVID infection has recovered, they developed new COVID symptoms that they did not have when they had the active infection going on. And again, this can go on up to 12 weeks. So we now call these things post-COVID-19 syndrome. Again, diabetics are at increased risk of having that type of problems because of, again, the vascular nature of how COVID causes this disease, similar to the vascular nature of how diabetes causes this disease. Some of you who might be listening to my deliberations today might be men. So, and you might be young men. You might be a young man with type 1 diabetes, which is insulin dependent, or you might be a middle-aged man with type 2 diabetes, which are diabetes that corresponds or responds to oral medicines or tablets, if you want to call it this way. For the men who are listening to this, let me be very clear and candid with you. Diabetes interferes with the blood flow of our vascular system by causing damages to the inside walls of your blood vessels. And these damages in the walls of the blood vessels causes cholesterol deposits and lipid deposits to get stuck in those little potholes, if you want to put it that way. And the more they get stuck, the more they build up onto one another. And then the body has a sort of a mechanism that goes into place whenever there is blockages in the blood vessels, and it leads to plaque formation. And over the years, these plaque formation cause a decrease in the flow of the blood into the blood vessels. And that's what leads to peripheral vascular disease, as we call it in medicine. But locally, you can say this is what leads to circulation problems in diabetics. COVID-19 worsens that situation. So for the men, I'm going to speak specifically to you. The erection of a man happens because of blood flow into his penis. And men must understand that. Blood flow must flow into the penis in a very undisturbed way, an uninterrupted way. It must get into the penis and must saturate the muscles of the penis, and the blood must get stuck inside there so that the good erection can happen. For many men, middle-aged men especially, who are diabetic, the strength of your erection is a very good indication as to how much damage this diabetes is eliciting on you, on your cardiovascular system. Because the same blood vessels that supplies blood to the rest of your body is the same blood vessels that supplies blood to your penis. So in other words, for the male population, the strength of his erection is like a temperature, is like a clock or temperature regulator, if you want to put it that way. In other words, the strength of the erection indicates the onset of cardiovascular disease. And that is something men who are diabetic must internalize very, very much, because it's a very serious matter, especially in relation to COVID. Because remember, as I said earlier, the way COVID causes its disease is much similar to how diabetes causes its disease. Diabetes damages the inside of your blood vessels, causing cholesterol to deposit there. COVID-19 does a similar thing where it damages the inside of the blood vessels and can lead to clots being formed and organ failure being formed. Also recall, I indicated to you that it seems to us that COVID-19 simply fast forward a problem that you may have had lurking in the background there before. So it looks as though the men who are diabetic, who are on their way to develop erectile dysfunction, who may not have had erectile dysfunction yet, but if they get COVID-19, COVID-19 simply speeds up or fast forward the erectile dysfunction. And that's why so many papers are now written that demonstrates that men who get COVID can actually develop erectile dysfunction as a result of the COVID infection. So especially for men folk who are diabetic, this is a very serious matter because, of course, it tells you that you are at risk of cardiovascular system, notwithstanding the emotional and psychological pressure that this event will put on you as a man, knowing and understanding how important an erection is.